Yeah, sunny Florida. We are in the town that I grew up in for a couple of days, and then we're going to drive down to Disney World and spend 5 days in Disney World. And then Lee and Alex will fly home, and I'll drive my mother back, and then I'll fly out the next day. You know, there is something so incredibly humbling about coming back to your hometown. I think you have to go back to move forward. As odd as that sounds, there's something really powerful about coming back to where you grew up. It has a way of changing you. It's November 12th, and unless your spacecraft just landed following the maiden voyage to Mars, you're well aware of what happened in the United States just a few days ago. I've been thinking a lot about the events that have transpired over this last week, and I think maybe it's best summed up in an email that I've received from a partner that we have. An organization that we've worked with for a long time sent me a message and said, first off, they wondered aloud about the circumstances that happened. And then they said, what does that mean for HBI? We wonder if that has any impact on the work that you've been doing with us. And I think at first I sort of had this reaction of fear, like, oh my goodness, they're right. This could have a big impact on the work that we're doing. There's a massive number of blog updates already on the World Wide Web purporting that the changes in our presidential administration will have impacts in terms of not-for-profits' ability to generate income, to connect with donors. You know what? I don't pretend to have any answer to this situation, but I will not act in fear, and I will not act in a way that mires me in partisan politics. Whatever happened a few days ago, I'm not gonna try and dissect it here. I'm more than happy to have conversations about it over a glass of wine or a nice IPA, but this is not the forum to have that discussion. But what I do know is that our work, the work of Health Bridges International, the work of not-for-profit organizations around the world, our work is the in-between work, the in-between the government and the civilian sector, the in-between faith-based organizations and non-faith-based organizations, the in-between charity and governance. And in that work that we do, the in-between work is more important now than ever. The bridging work that Health Bridges International does is now important beyond measure, not because of some partisan change, but because of change. Change brings about fear, and our work should be to continue to create bridges to support populations who are vulnerable, who are marginalized, who don't have a voice. I'm confident that our work will continue. I'm confident that the enormous number of donors who have so graciously provided us with their resources will continue to do so. And I'm reminded of a blessing that is said in the Episcopal faith at birthdays. And it goes, watch over thy child, O Lord, as her days increase. Bless and guide her wherever she may be. Pick her up when she falls. Stand by her when discouraged or sorrowful. And thy peace, which passes all understanding, abide all the days of her life. And now, in this time, our work is to pass that peace, to hold that hope, and to be the vision for the future, for people who deserve a future, very much deserve a life that they define. So Health Bridges International, we're going to keep going. And our work, it's beyond politics. The blessings that we have and the work that we do, it's bigger. Thanks for all your support.